today's presentation, I would like to share about the Ayurvedic module of the software presentation. We are Tirupati HIMS, a leading healthcare software solution development company since 2014, and we have various kind of the software edition for the different specialization healthcare industries requirement. So in today's scenario, I am preparing a Ayurvedic and Panchkarma relevant operational flow of the software and respective reporting and progress report. So let's log in with the Ayurvedic application. Okay, here are the login credentials we are using here. Ayurvedic ID password for the software. And once I log into the Ayurvedic user account, there are the respective modules are you can see in front of you, which are the provided dashboard, appointment, registration, token display, e-prescription, OPD billing, laboratory, radiology, IP, doctor notes, nursing desk, discharge summary, IP billing, Ayurvedic Panchkarma operational process, physiotherapy, MIS reports, and record register, referral, patient MRD, master, pharmacy, and SMS or bulk notification like that. So this is the dashboard where the dashboard administrator can get how many number of patient has been visited and what is revenue received in the Ayurvedic section, and then IPD admission, laboratory services, radiology, pharmacy, medical sales report like that. Okay, so here we have to make a patient Ayurvedic patient to perform this activity. So we go to registration window. Here we can take a patient photograph also if needed. So here you can take a patient photo with webcam. Here we can have patient panel selection, which kind of the patient it is, insurance, cash, Ayushman Yojana like that. Which you, for example, let me select an OPD patient, and here patient's detailed salutation, like patient put here Ravi Kumar Verma. Patient age, we put here patient age along with the respective department to show. Here to make a Ayurvedic flow, we select this specialization. Under the respective doctors list will be open to whom patient should be visited. So we select Ayurvedic doctor. Once we select respective doctor, the corresponding consultation fees software will automatically fetch from master here like that. Along with patient's mobile number we can put here, and like this way what is his mobile number, and system will fetch if any record is found with the same mobile number. Here patient's requested address. So here red mark fields are compulsory field, rest fields are optional. Okay, so let prepare patient relative name also, and if any ID proof, Aadhaar card, voter ID which you can like to take, you can take it. The rest, these are the optional fields like that. After having so patient total payable amount is 220, it is paying cash, card, UPI, you can select the mode of payment. And once you save, this record will be saved here as a prescription. System generate a patient's OPD predefined template along with the patient consultation service receipt will be generated. So this is the first stage where patient come to the hospital and give his basic information, and we can make him registration and generate a OPD file of prescription. Now the patient we can send it to pre-screening OPD window or token display, where nurse or the respective ward boy can able to find out his vitals record here, and we can mention his BP, pulse, respiratory or preliminary examination of patient, how much records has been received, and here we can mention 86 by minute pulse rate and SpO2 like 72 by minute, like this way. Respiratory 16 by minutes for example, and we can mention what is the complaint like sciatica pains in duration like 15 days, and it's in the back side. So on the body parts, lumbar temperature 103 Fahrenheit, body fever temperature like that, and any other information is needed to be pre-collected that can be added in the master will come here, and we have submitted this record. Now when the nurse wanted to send this patient to respective doctor's cabin, she click on accept button. This patient will go to the respective patient's doctor cabin, where the doctor can see his patient's records, and the doctor can select the patient, and once we select, Here we'll having option to patient detail vital record which has been mentioned by nurse will reflect here of the patient biomedical waste and other things. Here the doctor can also collect his previous complaint of patient, what is the previous medical complaint on which side of like that, inside outer side or right side, only like chest pain or something. So the complaint we can multiple complaint we can mention in the software. Throat headache, or left brain, left body part we are brain like that, 2 times 2 months like that. So this way, and here is the Panchkarma relevant clinical examination can be performed like Prakarti of the patient, what is the patient's Prakarti, either it is Vata or Pitta or Kapha like that. Based on the selection of the symptoms of patients, we can system can identify or distinguish which kind of the patient's complaint find out. So if we select here the patient majority is come Pitta, so the complaint system defined as a Pitta. If we select multiple orders, so it convert to the Vata like that. So this is the two type of Vati Prakriti has been justified by system. Apart from that, if we select Ashthvidha Pariksha or patient, so we can select kind of the pre-selective values of the in this value like frequency, gandh, pravarti of patient, mal definition here. So we can select respective pre-selection of the gandh like that jiva. So what is the information about jiva has to be selective like that. So this way you can select the information, and based on that the system will do the necessary action. Now after that, having Ashthvidha Pariksha, also having the Dashvidha Pariksha like Prakarti, Vikrati, Sar, Sahanana, Praman, Samyatam, Satu, Vaya, Shakti, Ahar Shakti, Vyayam Shakti like that, and you can select them, and writing patient's primary examination or from every segment services like this way we can select them. These are the coming from master data and Shodh Pariksha also if needed, inspections like that. So if we, and here it is writable field, so doctor can write if anything needed to required writing here like that. And here if any investigation to be advised like blood sugar test to be performed like, and sugar profile, electrolyte, or so various tests we can advise to the patient, and blood group, ABORS, SGOT, SGPT, so various tests we can prescribe to patient, and BTCT like that. So these are the pathological tests can be also prescribed. Here you can prescribe X-ray, CT scan, MRI if needed to investigate for patient. We write any treatment or we can follow anything. So we can mention the required information to the patient billing. Along with here, if we having patients medicine services like part of many medicine to be required to the patient. Okay, so during how many days duration like 5 days and TDS after meals like that, along with the diabetic DSR or zinc COVID. So respective medicines duration doses can be prescribed, and 5 days BDS and the automatically calculated doses. There is also having regional language selection option also. There is the diet advice options also, which kind of the diet to be added to the patient. Diet it is same if you order diabetes or diabetic like that after that, and customizable food we can prescribe along with the when prescribing diabetes Ayurvedic prescription, and we can advise what is the therapies we can prescribe to the patient. Here we can advise how much oil or telam we can advise during the therapies, which kind of the tail and services we should select. So various kind of the service request based therapy we can put in the system software like this way. Okay, so once we do, this request will be performed here in system entry. So this is we have prescribed patient entry record, and here any other things like to be added, so that doctor wanted to prescribe his previous record of the patient, so we can select if this allergy or previous disease was stated positive or negative, like that. And system will prescribe services into the system entries of. Okay, so like this way, once we save and print the prescription, the system will be give a printable confirmation of the prescription for this Panchkarma. Okay, so this is the prescription window has been printed, and you can perform this entries record in the software. Printable prescription stored in the software. Whenever we click on the patient to retain his previous prescription, also if we click on date and time, the further his prescription data will be populated here. What prescription we have advised here in the software can be done here. Okay, and once now the patient go to the billing desk, and that moment system will fetch all requested billing to the respective patient. Like patient, if we select of the patient, system ask the billing guys, do you like to make the patient billing of respective prescribed item to by the doctor? So we click OK. The respective item services automatically populated here in respective field with the respective amount which is defined in the master. Here total billable value will reflect here. Now the user, if it is authorized, he can give the respective discount to the patient at the billing moment. If also having option there, if patient have don't money or full amount in cash, so he can make multi payment option like 3000 into the cash, some part payment he make payment to the UPI, and some payment due pending. So multi payment option best we can do perform billing for the therapy, like that. Okay, so we do the patient service billing report here. Okay, now after doing so, next stage the billing, once billing performed, this request will go to the laboratory radiology department to perform his patient services. If we have laboratory requested, so laboratory you guys can be see a select patient, and he can perform the lab reports, procedure and sample collecting, and perform report entries, like that in the system software. So here we can select a blood sample, urine sample, like that, just a submit, and the blood sample reports processing barcode sticker will come here, which can be used on blood container, urine container during the report preparation moment. Once the reports are prepared, and system either machine fetch interface, ALICE interface, we can get automatically result to reduce turnaround and error free. If manual input is also mentioned available, user can mention the respective report value here. The desired information data will be mentioned by user. High value or low value system will indicate here during the report preparation. Like this way, somewhere formula calculated value will be appear during the one thing report preparation, and we do some like this way report updating as a technician. And once the report technician has prepared, this will be reflect to the particular doctor's account. And here blood group of patient like A positive, B positive, or like that, so like this way. So we mention something value and 99. Okay, and the report have been saved. Similarly, if the radiologists also have option to prepare the report, so these are the printable report confirmation has come of the department best, like this. And if you like to give PDF or printable report, this is where the printable reports value with paginated report can be given to the patient here in also for the Ayurvedic patient. Now for example, now the radiology reports are also pending. So if we go for radiology window, okay, and let's see where this reports request is available to the user to perform report. Let me see if administrator ID, what is the request has been received, so the user can prepare report also. So radiology user go here and will select the patient. Its report will be available to processing. On this moment, the X-ray report supporting X-ray image file can be also uploaded during the patient report preparation. in the software, and here can be input of update of text template report can be updated by the radiologist along with the X-ray, CT scans, MRI. So the male report, whole abdomen report template can be selected. Here we can mention the size of the liver in echo station, so like 240 mm into 260 mm of the liver size, and supporting sonographic image file can be used here as a reference purpose to mention the radiology user. And the various reports, MRI, CT scan files can be uploaded for reference purpose, and just to save the record, so radiology report are uploaded in the department. So here is also having role based access to the laboratory pathologist department in charge, like that in the supporting department. Once report are prepared, the patients will go to the respective Ayurvedic doctor. So let's go with the doctor's account and Ayurvedic model window, and the Ayurvedic doctor will having option to see the report once reports are prepared. So we have patient Praveen Kumar. If I wanted to show the lab report, here you can see lab report button, radiology report buttons are activated. Once we click, the reports will be able to, all reports are open at same click, one of the report button is activated. If doctors want to see radiology reports, just we click the radiology report can be also seen here. Along with, if doctors wanted to see specific report also, so the specific report can be also accessible into the e-prescription window via we clicking patient, and we click patient date and time to get his data, and here I symbol are reflected. Only if some doctor want to see like CBC report, he just click in front of CBC report I symbol, and the respective CBC report value will be open here. If doctor want to see the patient serum electrolyte report, he will click on, and serum electrolyte report will be open here like this way. So the reference reports can be accessed. If they want to see the sonography report, just click on sonography report window. The sonography report along with the picture file will be open here to the respective doctor. Now the patient wanted to collect medicine part or any other service part, so he go to the medical sales window. The pharmacist will dispatch the respective medicine which have prescribed by the Ayurvedic doctor or Panchkarma therapist, like that. So these are requested medicine, and here mode of payment and total payable amount are reflected. After that doing so, we click on save and print. So the requested medicine we can supply here. If the medicine is specific not available in the pharmacy, the user can change the batch code quantity, how much quantity to be sell they can supply, and just a save and print. So the medicine sales receipt is performed into the Ayurveda. This is the basic flow. Now the specific, what is the different in general medicine and Ayurvedic. So little bit the procedure and services. So once we recently have done a one therapist procedure billing. If we go to the Ayurvedic Panchkarma Therapy services, so here department we select here Praveen Kumar patient has been reflected. Now you can see we have billed for 3 item patients, so therapy service. So here payment status marked by system paid at the billing window. Now the therapy need to be scheduled. If we click on schedule therapy button, all 3 window will appear. 5 days therapy to be planned for this patient, and here which therapist user will have to perform this therapy. So we can select here therapist names in different department. Here date and time for which date therapy to be scheduled of the patient in different cabin, like that. So if we select the therapy room number or OT cabin number and table number, we can select it, and this way we just save and print. The therapy will be scheduled, and the sticker will be generated for 7 days for both therapies 2 times. So the patient will brings this stickers during the taking the facility of therapies of different therapy has been performed. Now whenever the therapy will be scheduled by the software doctor, and whenever the doctors or therapists like to perform therapy, they click on therapy window, and this kind window of the window will open. If one therapy one day patients has been performed, that moment the therapist will correct coupon, and reference therapy coupon will be approved, and the service will be given to patient. So once the coupon is disabled, means one therapy has been given to patient. Whenever the next patient the second therapy to be come, second day patient comes, so that one therapy has been done 4 is still pending. If we bring the coupon number 349 next time and we click on that one respective coupon, this therapy has been occupied. So this means the therapist consumption marking can be done. Similarly, another therapist, this therapy has to be performed. So this way therapy marking can be performed over the patient onto the Ayurvedic department. Similarly, into the physiotherapy department, every particular services to be provided to patient. So we can select the patient, and if any therapist is there, we can perform here therapy. So before do any therapy, we have to perform the billing service of a patient. We go billing window for the patient and select patient name, and we can go here therapy physiotherapy window, and whatever therapy we are like ultrasonic therapies along with the shockwave therapies like that. So we can do like 5 days therapy we like to give, and just we make the billing for patient, and just the therapy will be request will be done. After billing, this request goes to the therapist department. The therapist department will able to make the requested therapy to be planned over the patient. So we go here main menu, and here into the main menu we can able to schedule the therapy of physiotherapy service department on this particular patient. We can select the patient. These are two therapist request has been received. Now if we like to schedule a therapy of this patient, we click on view coupon or generate coupon like that one, and plan the therapy information to the patient. And just if it is not authorized because it is not allocated, now let me log in with the administrator account, and we like to plan the therapy. So if we go to therapist window, here we'll having option to plan the therapist, and the therapy will be planned of the patient, and receipt will be generated of the particular radio, and the therapy will be treated of the patient how much day. If we have any correction to be performed, so we can do therapist requested item which department to be therapist done perform like that. So this way we payment has been performed. So this is the billing window. So these are way we can maintain therapy services, and the physiotherapy part can be maintained here. So now come back to Ayurvedic window. Okay, so we go in therapy section services, and we select any patient, and we can do any either again billing and perform his therapy services like that, and how much duration requires like this per day coupon of 5 days 2 time, and the another therapy like quantity 2 time of 5 days, and this is the billing pay we can maintain of the patient with of therapy items request. After billing perform, this therapies we can plan on the patient. The here you have the billing copy confirmation. Once we select, and we can generate coupon for how many days therapy one therapy to be performed. So the one therapy is plan successfully generated. If we like to say generate another therapist confirmation, generate coupon for 5 days duration from date and which date we are like to start, like for example 22nd to 27, 5 days coupon to be generated. The coupon will be prepared. Now when we like to give a print of view coupon entry, so we give thus 10 coupons printable windows appear here. Whenever the user take a therapy, the therapist will confirm the one entry therapist has been performed. Similarly, when the next day patients come with to acquire the therapy, the one coupon has been consumed. So this way the consumption history can be maintained, how many coupon has been allocated and how much is the confirmation has been done. So this way the therapist marking can be maintained here, therapist day-to-day operation window. Now apart from that, we like to see the reporting part, how much revenue collection and observation. So we go to here search revenue for laboratory, medical collection, consultation services, hospital. So different ward wise physiotherapy, panchkarma item services billing. This type of the revenue observation can be done. It can be also categorized with the user category, head wise report, user wise report also, and patient wise reports. So various reports observation can be done. The same report can be sent into the balance sheet bifurcation of any specific duration basis, like that. So if you select to see full month revenue observation, so this way the observation of balance sheet can be also maintained to finance side of report, income and expense comparison. Here you can go to the MIS report to access your full month revenue report of the all headwise revenue information in the system defined here. Even you can see the doctor basis revenue observation, which doctor giving you which kind of the outputs of the service item, service history, like that. So this was a little bit briefing of the Ayurvedic flow system software of the Tirupati HIMS teams. If any questions regarding to the reporting operational flow, any kind of question, they can put in the comment box. Either they can call us, our customer care executive and or sales executive. They will guide and will prepare the next video over the requested module. And thank you so much. Have a good day.